Going to SPECT. SPECT imaging provides reliable information on myocardial perfusion and to some extent is cellular viability. So basically this assesses the myocardial perfusion. So viability assessment can be performed either with 99M technetium system AB or technetium tetrophosphate or 201 thallium serum. So both system AB or tetrophosphate are transported passively into the myocyte and are sequestrated within the mitochondria. So tetrophosphine and system AB, they go and transfer passively into the myocyte and are sequestrated within the mitochondria. So these are taken up by the mitochondria. So uptake requires negative transmembrane potentials of sarcolemma and mitochondrial membranes. So if the tissue is viable, that is the sarcolemma or mitochondrial membrane, if it is viable, then only they will be able to take this system AB or tetrophosphine. Otherwise, if the tissue is dead, mitochondria will also be dead. Mitochondria also will be dead. So this tissue will not be able to take this system AB or tetrophosphate and thus denotes the non-viability. However, the thallium-201 mimics potassium and is taken up by actively into the myocyte through the sodium-potassium ATPase. So uptake of thallium-201 depends upon the sodium-potassium ATPase, whereas system AB and tetrophosphate are dependent on the myocyte as well as the mitochondrial membrane integrity. So the uptake and retention of all the three traces is dependent on regional blood flow. So the regional blood flow is good, and the sarcolemmal membrane integrity is important for thallium because at sarcolemma there is sodium potassium ATPase, and mitochondrial membrane integrity is important for system AB and tetrophosphate. So areas with persistent little or no tracer uptake indicates so there is no tracer uptake. That means the tissue is non-viable myocardium. So rest only images demonstrate preserved or only mildly reduced perfusion are also indicative of myocardial viability. There are various protocols has been developed which are obtained from thallium-201 imaging is stress redistribution imaging, late redistribution imaging, rest redistribution imaging, and thallium-201 reinjection. So viability assessment with thallium-201 SPECT, that is single photon emission computed tomography. So thallium-201 behaves pharmacokinetically like a potassium analog. And this thallium-201 is an active sodium-potassium ATPase pump dependent process. So it is present in the cell membrane. If the cell membrane integrity is maintained, the sodium-potassium ATPase pump will take this thallium. So the thallium-201 myocardial uptake is an indication of regional perfusion, which is necessary for tracer delivery. One of the important characteristics of thallium-201 myocardial uptake is its redistribution property. So this phenomenon was initially described in the late 1970s with reports of stress-induced myocardial perfusion defects that appear to normalize on repeat imaging at different time intervals. So this property is a consequence of constant exchange of the radiotracer between the myocardial cell, extracellular space, and subsequently the blood pool. So whenever a tracer amount goes into the myocardial tissue, so in between there is an exchange occurs between the myocardial cell and the extracellular space and the blood flow. From blood and myocardium, there is constant exchange of this tissue, this chemical which keeps occurring actually. So in areas wherever there is decreased perfusion, so suppose if a myocardium has taken uptake of this thallium, but if at that region there is decreased perfusion or with diminished coronary flow, so what happens is that from myocardial cells, this coronary arteries and this blood supply will not be able to take this radiotracer back, and there will be persistence of this thallium 201 staining will be present in there. So thallium 201 extraction will be slower than in those with increase of normal blood flow. However, over time, what happens is thallium 201 continues in areas with diminished blood flow, whereas the radiotracer washes out from the areas with normal or increased initial blood flow. So if the blood supply is good from that area, there will be washout will occur, but remaining place there will be no washout. This constant redistribution of thallium 201 manifests on delayed imaging with resolution of the initial perfusion defect in areas. As thallium-201 uptake requires sarcolemma membrane integrity, resolution or reversibility of perfusion abnormality is considered to be myocardial viability. So initially, if there was defect, but later on, if there is uptake is happening, that means that area is maintained by myocardial viability. You can see here during stress rest, there was no uptake in this region, and after redistribution, like after later on after 24 hours or 3 to 4 hours, if you can see there is a more uptake of this area has been seen. So this is considered to be a viable tissue. Thallium-201 viability assessment protocols, you can take 4 hours stress test is 4 hours and 24 hour delayed redistribution protocol has been filmed. So it has been seen that at 18 to 24 hours could improve the ability of the test to predict functional recovery after coronary revascularization. So late redistribution images are acquire a third set of images at 24 to 48 hours. This would allow for redistribution of the tracer to very ischemic tissue at viable tissue. Then with the 22% of fixed defects at initially can have later on will have a thallium tech can be seen. Okay, so standard SPECT images displays the short axis, which represents the anterior wall, inferior wall, lateral wall, and septal wall. So you can see here. And now, if you see this part, so you can see during this is infarct area. So this part you can see decreased uptake. That is the lateral part, and the infralateral part there is decreased uptake. You can see here even the posterior wall there is decreased uptake can be seen. So stress-induced ischemia you can see here. Again, there is decreased uptake. That means there is decreased intake of that. There is decreased viability of that tissue. So viability assessment with technetium 99 SPECT. Following the restriction from the blood, technetium 99 traces binds to the mitochondria, and thus there is results in negligible washout or redistribution. So there is no redistribution or washout occurs of technetium. So repeated scans, that is after 4-hour imaging or 24 imaging, is not required here. The advantage of SPECT is that it is readily available. It is part of a routine stress protocol. It is more sensitive than dobutamine stress echo. A disadvantage is that it has highest radiation exposure. It is all or none interpretation. It is prone to attenuation artifacts, especially in obese patients.